Hello, I'm Dr. Deborah Salter. Thanks for joining me for my talk on vitamin D demystified. So, for any of you who have seen me or anyone in my practice, you know that no matter what, when we try and make sure that we get you started with things, one of the things I always focus on is vitamin D. We try and stress that it does help us let go of weight, which is why it's very important with the journey that we're helping you on. But it's a really important vitamin, and I like to have people understand that there's more reasons than just losing weight why we take it, and also reasons why we run into difficulties with deficiencies. So if you'll bear with me while I share my screen here with you, we'll just go forward and we'll talk a little bit about it, and then we'll answer questions at the end. If you have any questions during, feel free to go to the chat bar on the bottom, and you're more than welcome to go ahead and put in any questions or anything that you have there. I'll try and address them as we go, but most importantly, I'll make sure we get to them at the end. So this is all about demystifying vitamin D and just helping you understand why are we using it and why do we do it. So what happened? So sorry, we just went past it. So the third National Health and Nutrition Examination Survey, which they call the NAMES 3, looked at what kind of deficiencies do we see with vitamin D. And interestingly, 40 to 90% of the elderly, which is people 60 and older, as it was defined in that, which puts me there, are vitamin D deficient worldwide. So that's across the whole world. But 25 to 57% of US adults are vitamin D deficient. We'll talk a little bit about why people that struggle with weight also are at greater risk for it. But again, certainly in my practice, I see it much more on the 57 end than the 25 end. So not only do we find those deficiencies in that range, but also when we talk about optimizing, there's a wide range of normal. And again, we're going to talk about where do we want to aim for if we're going to try and hit that goal. So what happens with the vitamin D deficiency? Let's just look at a few of the various areas that get affected. First and foremost is impaired mineralization of the bones. Vitamin D is responsible for helping us absorb calcium. Back in the 1980s, 90s, and early 2000s, we used to tell women, you need more calcium, you need more calcium. All these women are getting osteopenia and osteoporosis. And we just told them take more calcium. We finally realized maybe if we just had them take more vitamin D, the calcium that's in their nutrition and diet might actually be enough, or at least certainly be augmented. And it's not helping to take the calcium if we're not getting vitamin D in there with it. Both vitamin D and magnesium help us absorb the calcium and get it into our bones. So both are important. And without it, we get osteopenia, which is bone thinning, or osteoporosis, which is severe bone thinning. And once we get into osteoporosis, we start losing those bridges in our bones, and that definitively increases our risk for fracture. Let's see if we can go forward here. So number 2, so skeletal muscle effects. Actually, without enough vitamin D, we actually end up with muscle weakness. The more severe the deficiency, the more dramatic it is, and it can give us muscle aches as well. Interestingly enough, people that are on statins that develop myalgias, 90% of those people are actually vitamin D deficient. We talk about adding CoQ10 because the CoQ10 helps our mitochondria eliminate the lactic acid that builds up when we exercise. So if we don't have enough of that CoQ10, we're in trouble. But also, if we don't have enough of the vitamin D, we get more of the muscle aches and myalgias as well. So again, if you're on a statin especially, it's important to make sure you have adequate amounts of vitamin D. So cardiac effects. The heart dramatically is reliant on calcium and as are all of our muscles, for contraction. Vitamin D also helps with making sure that it helps with the healing and repair of the linings of the vessels. So cardiac effects that happen if we don't have enough vitamin D, helping make sure that when we shred those vessels, that we start clearing that lining and healing it. We end up with more difficulty with hardening of the arteries, leading to hypertension. We can have more difficulty with stroke, heart attack, coronary artery disease, and heart failure. Any of those things can happen. And again, not enough calcium and or not enough D, and it can lead to all of those. So vitamin D is important for healing and repair, as well as for absorbing that calcium. So driving that piece home. So vitamin D deficiency also can impair our pancreatic function. And the pancreas is where we talk about all of that stuff to do with insulin resistance and insulin production. But the beta cells in our pancreas actually produce the insulin and are responsible for making sure that we have that insulin to drive glucose into our cells. If those beta cells are impaired and cannot make their insulin, we start having more and more difficulty with insulin production. That can lead to increased difficulty with type 2 diabetes and all of the symptoms and syndromes coming up to it. As we've talked about before, insulin resistance, prediabetes, and diabetes are all just on the spectrum of insulin resistance. So vitamin D is important with that, and metabolic syndrome is just a compilation of lipid problems and glucose problems that, along with hypertension, that are all just one big catchphrase for a lot of those diseases. When we put them together, we see them happening in a group. But again, pancreatic function, insulin resistance, important for the vitamin D deficiency to be corrected. And again, a big reason why I look at it in my practice. Mood and immune system. Interestingly enough, when you go further and further north from the equator, we get further away from the direct sunlight, and depression rates actually increase as you move further north. I don't think it's just because they don't like living in Canada or Alaska, but again, there's just a lot lower sunlight exposure. And so depression increases. Vitamin D is important for making those chemicals in our brain that allow us to focus, concentrate, think, and be happy. So again, it helps with depression. And we often hear about SAD or seasonal affective disorder, or know that people get the wintertime blues. And it can definitely relate to the lack of sunshine exposure and the decreasing levels of vitamin D. So when we start people on vitamin D and get their levels up, typically people will notice that their mood feels brighter and lighter just because they have the vitamin D around, whether they did it through sunshine or whether they did it without. Viral infections I mentioned here specifically, but just our immune system in general relies on vitamin D for keeping it healthy. And it was interesting, during COVID, they found that people that had higher vitamin D levels did not get COVID as often. And when they did get COVID, they did not get as sick. It's not just because it helps with COVID, but it also helps just with immune system in general and keeping our immune system boosted and bolstered so that we don't get sick as often. And when we do get sick, we get better faster. So risk factors for being vitamin D deficient. And as I mentioned, for those of us that struggle with weight, vitamin D is distributed throughout the fat cells. So if we have more fat cells, the vitamin D gets further distributed. And so we don't have as much in the blood to help us with our absorption, or for putting the calcium into the bones, et cetera. So again, the more weight we carry, sometimes the greater our risk of vitamin D deficiency. And sometimes the more D we have to have, at least to catch up with so we'll start filling that vitamin D and need to fill at higher levels at the beginning until we get our body vitamin D level brought back up. Kidney disease will increase it. It has to do with our calcium excretion and the GI malabsorption issues. If we're not absorbing things through the gut, especially people who've had gallbladder disease or don't absorb fat sufficiently for some other reason, have colitis, inflammatory bowel problems. If we're not absorbing those fats from the bowel, we don't get those fat-soluble vitamins, A, D, E, and K, but vitamin D being the one we're talking about now. And that's really important that we're getting that absorbed. So if we have GI problems or malabsorption, absolutely making sure that not only do we probably need to take vitamin D, but we absolutely need to make sure that when we do take it, that we are actually able to get it absorbed. Liver disease, we convert the vitamin D2 and D3 into their active forms, the forms that we need to be working to get the jobs done. We convert that in our liver. And if we have liver disease, hepatitis, or chronic cirrhosis, or any of those kind of liver damage or liver issues, we do not convert it as efficiently. So even if we're taking vitamin D, we may not be getting it activated, and we may still effectively have a low vitamin D. Inadequate sun exposure, as I said, as we go further north in the world, there's oftentimes less sun exposure, and vitamin D deficiency is certainly greater at those higher climes. So when we go to Canada, Alaska. As you know, some of you know, I worked there. When I was in Alaska, even at our computer stations inside, they would give us full spectrum light so that we get exposed to that during some of the day, especially because the days were so short there. There were days that were, 4 or 5 hours of sunlight period, and the sun would just barely come over the horizon. So using that full spectrum light can be helpful. We do use those as well for people that struggle with depression during the winter, and getting that full spectrum light. It's not just a lamp. It is actually a specific lamp that has all of the different radiation levels in it. But darker skin color also is one of those issues because they do not create the vitamin D as effectively in their skin just because of the darker skin. So people with darker skin color tend to be more deficient. With the sun exposure, the one thing and I think we've got it here just talking about it. We'll come back around to sun exposure in a minute, but medications that can increase the breakdown of vitamin D and cause us to lose it faster include anticonvulsants, some of the AIDS treatments, and steroids. Steroids, it makes a difference also with higher levels of topical steroids to treat rashes and those things. Please realize that those do get absorbed into your system. Respiratory steroids and nasal steroids can slightly increase the vitamin D loss. So again, any use of steroids, and especially oral steroids that we use for decreasing body inflammation, including asthma exacerbations or any of those COPD exacerbations, anytime we're put on those steroids, we're depleting our vitamin D faster. So if we are on any of those or on a longer treatment of those, we may need to bolster our vitamin D replacement during the times that we're using those medications. So for vitamin D replacement, there are two main types. There's vitamin D2, which is the ergocalciferol, and vitamin D3, which is the cholecalciferol. Vitamin D2 comes from plant-based sources, and the D3 comes from animal sources. Both, as we said, are broken down in the liver to convert it into the activated form, hence the issue with the liver disease. And again, both are very effective. I oftentimes will use a higher concentration of a vitamin D so that we can take it less often. And when we use the higher concentration, there's a better chance that we're going to get a good portion of that absorbed because we're loading those receptors. So I oftentimes like to do the higher dose and do it less often. It also leads to better compliance when we only have to do something once or twice a week than we have to do something every day. But either the D2 or the D3 works. If we're using the D3, usually we're taking the vitamin K with it as well. But we can talk more about that at another time. But the D3 should be with K if you're getting it over the counter. Keeping in mind that when we have a vitamin D level, our goal is between 30 and 100. I still don't know. Kaiser will still say that 20 is acceptable, but there's not another lab in the world that will say as low as 20 is okay. The interesting thing with how they find what is our goal level with any of the vitamins that we take is they look at a population, they say this looks like a pretty healthy population around between these ages. So what is their vitamin D level? And they check the levels and they say, well, that must be a good level. And it was early in the 2000s when we finally started realizing that vitamin D deficiency was a problem. We did say anywhere from 20 to 50 was normal. And what we found is when we finally started replacing D, the people that were closer to 50 with their number were doing better. It's certainly not toxic. And we don't even get toxic till we're well over 150. So they started saying, well, actually, probably the people at 50 are better. So they started sliding that up the scale. And over the years, it's now come to where they say 30 to 100 is the desired range. With the 30 to 100, I find that, again, in order to keep people healthier, people with the higher levels tend to do better. I don't like to go over the 100, but I do like to aim for about that 75 mark. Somewhere over 50, but below 100 is where I aim for. The typical dosing that I use is somewhere between 50 and 100,000 international units per week. And that's usually measured, and I usually measure your levels as a D25OH level. If that level is low, for every 10 units that we want to go up, about 1,000 international units per day on average, we'll raise that by 10 nanograms. So again, if you were in the 20 range and we wanted to get you into the 50 range, there would be 30 difference. So that would be at least 3,000 more than whatever you were getting at that point as a minimum, just to get you to 50, right? So again, when I place people on it, I usually will use 50,000 once or twice per week, depending on how low people were, depending on their other health issues that they have. And we'll usually do that for anywhere from 3 to 6 months, and then usually 50,000 or somewhere around 10,000 per day, 50 to 70,000 per week is usually pretty average for longer term, usually no less than 5,000. I do have a rare person that needs only 1 or 2,000. And so it's a good reason why, if you are taking vitamin D and higher supplementation, usually in 3 to 6 months, we'll make sure that you're really absorbing it, that it really has come up into better numbers. And then as we reduce that within 6 months, you want to check it one more time and just make sure it hasn't dramatically dropped because you've lowered that level. But remember, it is fat soluble. It will build up in the body. So we want to try and fill up the body. But once it's full, we don't need to take as much to keep that level in that adequate range. So what are some other ways that we can get vitamin D besides just taking supplements? Certainly, there are foods that are high, naturally high in vitamin D3. I've got a list here, and this list will be available in the blog that we put up after this is over. But fatty fish, including salmon, mackerel, sardines, tuna, trout, cod liver oil, those are very rich sources of vitamin D3, and it's just naturally occurring. So again, a good way to add some. But for those of us that are trying to lose weight, we're not trying to add a whole bunch of extra food sometimes in order to get our vitamin D. So sometimes supplementing with a supplement makes sense during periods of weight loss. Egg yolks, but not the whites, are very rich in vitamin D. Beef liver but again, partly because in the liver is where we process our vitamin D. So again, beef liver is just something that's available in larger slabs, but it also brings a lot of other things with it. So talk to your provider to see if beef liver is a good way or a good source for you to get vitamin D3, just because of the other things you can be exposed to, but it is really high in it. Small amounts of cheeses, some of the cheeses will be higher in vitamin D. Again, usually when we fortified the milk that has made the cheese, then the vitamin D will be present. So again, sometimes the milk they made the cheese out of was, and sometimes it was not fortified with D. It does not usually naturally occur that way. When we look at added vitamin D3 or D2 to different foods that we've done, of course, it made good sense when we started having everybody drink milk and eat yogurt. We realized not everybody's getting the calcium out of it. So they started adding vitamin D to it. So we actually got the benefit of the calcium in that food source. Plant-based milks like almond, soy, and oat, they'll also add those vitamins to it. Usually oftentimes the D2 will be added just because it's a plant-based source in those, whereas D3 is oftentimes used in the milk base. They're fortifying orange juice now. Interestingly enough, the acid in the orange juice sometimes can deplete or decrease our ability to absorb it. So I think it's always interesting that they put it in there, but it may help us better with not losing it. Fortified cereals, that's always one of those oxymorons, I think. You know, we take a grain and we process it into oblivion and add a bunch of additives to strip out all the vitamins, and then we put vitamins back in it and create something out of it. So, but fortified cereals, oftentimes they'll add Bs and Ds to those. And again, it's usually fairly small amounts. Margarine or butter, again, same thing with the milk and yogurt when we fortify things with it, and or they'll definitely infuse sometimes margarines, which with the vitamin D. So you can watch the labels on them. But again, you're going to get very small amounts with any of those fortified products. So when I'm replacing people with those higher numbers, like the 50 to 100,000, I don't have them modify those vitamin added foods. It's not going to be substantial enough to make a difference on what we're doing with trying to add it. If people are eating a very high diet in those fatty fish, sometimes I definitely will take that into consideration. When I was treating people with the omegas with vitamin D and omegas in Alaska, the vitamin Ds, we did not need to add as much when we were up there, nor did we have to add as much in the way of omegas, but they were still deficient in both. And the vitamin D, especially just because of the sunshine. They also had a seasonal availability of some of those fish. So during those other seasons, we needed to also bolster it. So just something to be aware of. As we mentioned before, a bonus of sunlight exposure, hence the reason I'm sitting on a beach here, which I wish I were, but enjoying the sunlight. We all like to protect our skin. None of us wants to age prematurely or even at all. But we don't want to see the aging. We don't want to get skin cancer. So, we are not spending time out in the sun like we did in the early days. We're not naked from sunrise to sunset out in the sun, right? So we're not getting nearly as much sun. And when we do spend time out there, we usually are lathering with sunscreen, wearing hats, and doing other things to protect ourselves. However, it is interesting, if you spend 10 to 30 minutes out in the sunlight, your body, even with indirect sunlight, can get some vitamin D. More importantly, for our mood, we have a site in our brain that's stimulated when we are facing toward the sun. We don't have to look at the sun, but when we're facing the sun, there's a site in our, an area in our brain, we'll talk about it another time, but it actually is stimulated by the sunlight, and it helps us increase the chemicals in our brain that allow us to focus, concentrate, think, and be happy. So the serotonin, norepinephrine, and dopamine. So getting outside and spending some time, 10 to 30 minutes out in the sunlight, is a good idea. We don't want to necessarily expose our skin. And certainly if you've had skin cancers, we don't have to do that. You can also get those full spectrum lights to sometimes help bolster the amounts that we have. But in general, most of us just need to be on a vitamin D supplement. So thank you very much for joining me. I hope you've gotten some good information out of this. If you have any further questions, please don't hesitate to ask. If you check out the deep dive page on the website at ywaitcolorado.com, you'll find more information off of this slide pack so that you can review it. And if you have other questions, feel free to write to us at ywaigedu@gmail.com, and we'll answer any questions you have. So I'm going to close out the recording, but then we'll take any other questions from anybody in the audience.